Hi, I would really want to highlight endometriosis. I'm sure some people have heard about it, and some people are not even aware there is something called endometriosis, which has become quite prominent in the early age group. Perhaps we even see them in the elder age group now. Endometriosis is when the endometrial lining, which is inside your uterus, those cells they spill into outside the uterus, being in your tubes, your ovaries, and sometimes even in the pouch of Douglas, affecting your rectum and sometimes even your bladder. Now, what is endometriosis exactly and how does it present to you? Many oftentimes, ladies, when they have lower back pain, excruciating pain during menses, and it goes unnoticed for many, many years. Of course, when they approach a gynecologist, our first treatment of line is to cure the pain, and perhaps sometimes we put them on OCPs. Sometimes, when the lady's pain is excruciating, when we get a scan done, perhaps an MRI done, we find there are chocolate cysts in both the ovaries, or perhaps sometimes they have a blocked tube, or they could be having lower abdominal pain and lower back pain. So, why does this happen? I'll have to explain this to you that every month, when a lady has her menses, the endometrial lining inside her uterus is shedding, hence, you're bleeding. Similarly, the cells which have deposited in your ovaries or your tubes or outside the uterus, those also have an active cell count, and hence, those end up forming cysts and spots. When they are in the ovaries, they form cyst and it's called as chocolate cyst. The reason we call it chocolate cyst is because it's a dark colored blood which has been collecting over the period of time, giving it a consistency and a color of a chocolate, like a melted chocolate. Now, what do we do about it? In the earlier stages, we can perhaps try to control it by just medicines and injections. But when sometimes the pain is way too much, the lady might have to undergo surgery. I would always recommend a laparoscopic surgery when it comes to endometriosis because at times the entire abdominal organs and every surrounding tissue is so badly stuck to each other, and open surgery does not even give you a good look into what exactly has happened. Whereas in a laparoscopic surgery, having a good vision and a camera view to everything gives us exactly a good idea what all structures are involved and what all as a surgeon we need to clear up. Now, depending on the age group, in gynecology, everything is perhaps depending on the age group. If a young girl comes to us who's not married having endometriosis, our mainstay is just to clear up the cyst and the ovarian tissue, all the diseased ovarian tissue, and maintaining the normal ovarian volume so she can continue her life ahead. When a lady in the reproductive age group comes to us with endometriosis, wanting to have a baby, we do a thorough checkup of the tubes and the ovaries and the uterus and try to clear up whatever we can, perhaps to facilitate her pregnancy. When an elderly age group comes to us with endometriosis and perhaps she's completed a family life, in those cases we might just suggest for the removal of the uterus, depending on the age. I would really suggest you should definitely know more about endometriosis. And next time, when you're having excruciating pain, which is not going over with painkillers, do consider to visit a gynecologist and get yourself a thorough treatment and a checkup regarding the same. Thank you.
I know you heard she's a